Exosome treatment for intellectual disabilities. Exosomes are small vesicles that are involved in cell-to-cell communication. Because of their potential to transport therapeutic materials to specific cells, such as proteins and nucleic acids, exosomes have drawn interest. To treat intellectual disorders, exosome treatment entails separating exosomes from donor cells that contain therapeutic cargo like microRNAs or neurotrophic factors. After that, patients get systemic injections of these exosomes, which enable them to pass across the blood-brain barrier and deliver their payload to specific brain cells. The therapeutic cargo aims to enhance cognitive performance and lessen symptoms related to intellectual impairments by modulating cellular processes involved in neuronal development, synaptogenesis, and neuroprotection.